On Tuesday, August 25th, the school committee held its meeting in a hybrid model to show the district's confidence in opening schools safely. The committee members and school officials continued their conversation on reopening schools. They also talked about a draft for a face covering policy. The committee will vote on the policy at its next meeting on September 1st.
We need to commit to that as a district for our students and staff, at least in beginning in grades K all the way to 12. There has been some questions from staff, I will tell you, asking about preschool students being included in this as well, believing that that is possible for young students except for those who have a specific developmental situation that would prevent that from happening. In any event, we think this policy will be a tool that principals will use to ensure that everyone in the school community is appropriately wearing a face covering so that we can help provide for health and safety. And I will also state that one of the things I appreciate in this policy is that it very clearly states that if an individual is in violation of the policy, the individual would be removed from the school building for in-person learning until such time as they can comply. I think what we would do is we would assign them really to remote instruction until they're able to comply. But we take this seriously, that this is a public health emergency, and this is one of the ways we've learned it's important to manage it.
It is my personal and I guess medical belief that there are no medical exemptions to wearing a mask in a school building. And I've queried physicians at Children's Hospital and the pulmonary division about this, and they said really the only situation where you cannot wear a mask is if you just had facial trauma or facial surgery. That would be the only thing that would prohibit you from wearing a mask. There might be another condition, a chronic COPD-like condition, where you don't want to rebreathe CO2. Extremely rare in children, and that child probably should not be in school at this time. So bottom line is I do not foresee any medical exemptions for this.